some of you are very busy during the webinar. We already have a pile of questions here for folks to answer. So I'm going to send the first one toward Dr. Hilshore. The question is, do you customize the CATCH program for communities with different demographics, or is the CATCH program a one-size-fits-all? And if you do customize, how do you determine which program works for certain populations?
First of all, I'd like to let you know that I have two other people joining me to answer questions, Dr. Steve Kelder and Peter Cribb. And so I'll start out on this one, and then I'll hand it over to Dr. Kelder. But when we developed CATCH, CATCH was developed for the school setting. So within the school setting, there's a lot of room to customize it for the population. For example, in Brownsville and El Paso, we have the Mighty Amigos. So that is one way that they have adapted the CATCH characters to the specific population. Steve, would you like to expand on that?
We hope that each school district will customize it on their own because they know best what their target population is. And so we provide activities for across many, many different cultural scenarios and tastes and values.
Great, thank you. And here's another one for CATCH. This actually came in over Twitter. It's the first time we've tried this, so I'm glad it's working. So how has standardized testing impacted implementation of CATCH? In other words, have principals at schools been receptive to the CATCH program?
Dr. Kelder, do you want to answer that one?
Sure. You know, standardized testing makes it more challenging to implement programs like CATCH to a certain extent, but usually that falls in the place of the classroom curriculum. Most schools in the U.S. have a PE program, physical education. Most schools have a food service. So those components of CATCH usually take off and take root easily. However, you know, finding classroom time for the implementation of the classroom curriculum by teachers sometimes is challenging. So we've done a variety of things, like have a kickoff week at the beginning of the school year, or one, you know, at various times throughout the year. So those are the main ways we do it. But, you know, mostly schools are beginning to recognize that the relationship that was outlined in, I believe it was 2010 CDC report that relates physical activity and physical fitness to academic achievement. When superintendents and school personnel and principals read that and understand it, they're more likely to implement a program like CATCH.
Great, thank you. And here's a question for Dr. Coe. Dr. Coe, on one of your slides, you listed several administration or Department of Health and Human Services efforts that are targeting obesity and overweight and nutrition and physical activity. Can you explain how these tie in? For example, what is the Affordable Care Act doing to help combat obesity?
Okay, we've had so much transformation under this administration's leadership on areas of prevention and public health in general and obesity in particular. We have, on the prevention front, a national prevention strategy that I mentioned, a new National Prevention Council, a dedicated prevention fund. Obesity-related issues, physical activity, and nutrition issues are all tied into those efforts. On an individual level, health plans are asked to cover screening for body mass index without added cost to the beneficiary, so that's a big advance because we don't want cost to be a barrier. We have the tremendous leadership of the First Lady, as I mentioned, and we have a coordinating meeting every month across the department that I chair that helps on Let's Move initiatives and coordinates with the White House. I was delighted to see that the CATCH themes actually align with the Let's Move themes very, very nicely. And then we have, as I mentioned, not only the dietary guidelines and the physical activity guidelines that are constantly re-updated, but the President's Council that's really putting forward the message on physical activity has really been revitalized under this administration as well.
Great. Thank you very much. Now for Dr. Helscher. Can you talk about the importance of evaluation of your programs that aim to change health behaviors? I think that's one of the biggest challenges we face is evaluating changes in health behavior. So can you tell us a little bit about what you've done and the importance of it?
Yes. I think evaluation is always important for programs like this to demonstrate impact for funders and for other stakeholders in the communities. So we've done evaluation in many different ways, from the original randomized control trial in which we collected blood for cholesterol levels and did heights and weights and blood pressure, to the way that we normally evaluate now. So usually what we do when we're in schools, we have a series of questionnaires that we can ask students about their dietary habits, and then we usually do measure their height and weight as part of that as well. We also have some parent surveys that we've used at times. These parent surveys will ask about access to healthy foods at home and how safe the parents perceive their environment to be. We also have a series of measures that are done at the school level, and often that's not done. But we found it's extremely helpful. We have a series of tools that schools can use. One is a questionnaire that says, how do we know it's working? So it's a list of criteria that you can evaluate how well the program is being evaluated, how well the program is being implemented in the school level.
Great, thank you. And here's another question for you. Can you provide more details on how you bring the appropriate stakeholders together to work toward reinforcing each other's messages and combating obesity?
I think I'd like to direct that question to Peter Cribb. Peter, would you like to answer that one?
Yes, I might just defer to Steve for this one.
Sure. What we do is during training, we ask when we conduct trainings of schools or school districts, we will ask for a member at the school campus from the school administration, a lead classroom teacher, the physical education teacher, and usually the food service director of the campus. If we're training a school district, we'll ask for each of those people from all the schools that we're training, as well as district personnel. So what we do is we offer what we call a catch coordination kit. Deanna mentioned that. But when you train all those different individuals that have supervisory responsibility for classroom PE and food service, we break it into 6-week objective cycles. So during training, they plan together on how they're going to implement the various components of catch. And we find that the training part and having those different people with different responsibility makes all the difference.